Today, we're going to take a journey deep inside the human body. We're on the trail of a microscopic intruder, following it step by step as it wages this silent war, turning our own bodies against us. So how does it all begin? It's a pretty scary thought, isn't it? I mean, something you do every day without a second thought, taking a sip of water, grabbing a bite to eat, could be the very thing that lets a serious illness in. And that question right there is really at the heart of the story we're unpacking today. And here it is. Meet the villain of our story, typhoid fever. Now, it's a systemic infection, which is just a way of saying it doesn't stay put. Oh no, it travels all over your body. And the culprit behind it all? A bacterium with a pretty nasty reputation, Salmonella typhi. All right, so let's follow this invisible intruder. Let's see exactly how this whole infection gets started. And it often begins with something totally ordinary. So how does it spread? Well, the method is direct and, let's be honest, pretty unpleasant. It's what's known as the fecal-oral route. Basically, the bacteria are passed in the waste of an infected person. If that waste contaminates food or water that someone else then eats or drinks, boom, the cycle starts all over again. So, what this really boils down to is sanitation and hygiene. Now, here's where it gets really sneaky. After you ingest the bacteria, you don't get sick right away. It actually works in secret for a while. Usually, you'll start feeling sick after about 1 to 2 weeks. But look at that range. It can be up to 60 days. 2 whole months could go by before you have any idea that something is wrong. And during that whole silent period, this is what's happening inside you. The bacteria aren't just hanging out. They are on a mission. First, they break through the walls of your intestine. Then, they basically hijack your bloodstream, using it like a superhighway to travel around and set up camp in really important organs, like your liver, spleen, and even your bone marrow. So, once the bacteria are all settled in, the body just can't ignore the problem anymore. It sounds the alarm bells, and that's when the real battle finally begins. And the classic telltale sign of typhoid is this thing called the stepladder fever. See, it's not a sudden high fever. Instead, it just gets a little bit worse, a little bit higher, day after day. It's like it's slowly climbing a ladder. That's your body's response getting more and more intense as the threat inside grows. And this is a really fascinating little detail. It shows how the exact same disease can show up differently in different people. You'd think a gut infection would mean diarrhea, right? And for kids, you'd be right. That's what usually happens. But for adults, it's often the complete opposite. Constipation is actually more common. That's a super important clue for doctors. Of course, the fever isn't the only signal that something's wrong. Your body is in an all-out war. We're talking severe headaches, a kind of weakness that just completely wipes you out, and sharp pains in your abdomen. Sometimes this faint pinkish rash called rose spots can pop up, and on the inside, organs like your liver and spleen can actually get swollen because they're working overtime to fight this thing off. And this is exactly why catching it early is so important. If this battle is just left to rage on without any help from medicine, the results can be really bad. The bacteria can actually cause bleeding or even punch holes through the intestines, which can lead to a state of life-threatening shock. Okay, so with the stakes being that high, doctors have to act like detectives. They need to confirm their suspect, and that means launching a full-on medical investigation. And this is their toolkit. In that first week of sickness, the gold standard is a blood culture. They're literally trying to catch the live bacteria red-handed, swimming around in the bloodstream. A bit later on, they might use something called a Widal test, which looks for the antibodies your body has made to fight the infection. And in the really tough cases, a bone marrow culture is the most sensitive test they have. So, once the intruder has been positively ID'd, it's time to launch the counterattack. It's time to fight back with science. The number one weapon here is a course of specific antibiotics. They're designed to hunt down and kill that Salmonella typhi bacteria. But that's not the whole story. It's also incredibly important to give the body supportive care, making sure the patient stays hydrated and gets enough nutrition. And, of course, using fever reducers to help manage the symptoms while the antibiotics get to work. And this number right here, this is maybe the most powerful part of the entire story. Before we had antibiotics, typhoid could absolutely be a death sentence. The death rates were as high as 30%. But now, with this medical counterattack, that number plummets to less than 1%. It's just a huge, incredible win for modern medicine. So winning the battle is amazing news. But the bigger question is, how do we stop the invasion from ever happening in the first place? Well, the answer is all about building up our defenses.
And the best part is, this defense isn't some huge, complicated secret. It all comes down to a really simple, but very powerful, 4-point plan.
And here it is. This is your personal defense plan. It's all about breaking that chain of transmission we talked about. It starts with the absolute basics, like washing your hands. It means making sure your drinking water is safe by boiling it or treating it. At a community level, it means having proper sanitation. And finally, if you live in or are traveling to a high-risk area, there's a vaccine that can give you a powerful shield. So, we've seen the whole thing, from the silent invasion to the final victory. The journey of this one tiny microbe really shines a light on a much bigger truth about the world we all share. And that leaves us with this final thought. Typhoid is a powerful reminder that in our hyper-connected world, a health threat anywhere can quickly become a threat everywhere. So the question isn't just about how we protect ourselves, but how we make sure that everyone all over the world has the defenses they need to stay safe.